Well, hello everyone. Welcome to the Better Patient Results. I'm Dr. Brad Kristiansen. I've been a chiropractor since 1975. So over my career, I've seen several thousand patient visits. In 1975, I established a 300 visit per week chiropractic practice, and I did that for about 35 years until I had a personal health problem that was not getting the results with chiropractic, and I met Dr. Freddie Ulen, who actually helped my long-standing chronic back and leg problem, which encouraged me to learn some of the things I'm going to be sharing with you today on possibly helping you get better results. So, have you ever done the exact right service for a patient and they got no results? And then they came back and you did it again and they got no results, and then they came back again and you still got no results. Well, that happened to me also, not only with the patients I was seeing, but also with me personally. That's when I discovered with Dr. Freddie Ulen and the 5 barriers that can get in the way to somebody being able to achieve their optimum level of health. Not only some patients don't respond to the care you are rendering them, but they also, you do the exact right thing and all of a sudden they feel worse, and they'll come back and say, "Doc, since I saw you last time, I'm feeling worse." And you check them out and you discover you did exactly the correct thing, but they got worse for some reason. Well, that's part of what Dr. Ulen discovered can affect a person. So the testing procedure called nutrition response testing is accessing a thing called the autonomic nervous system. Maybe for some of you that's challenging. You have to remember way back when you learned all about that. But remember, the autonomic nervous system is that part of our nervous system that controls and coordinates the internal organ system and helps our body respond to its environment. Well, there's a situation where if the patient is actually not open to healing, that means they don't respond. Or if their nervous system is in a state of dysregulation, it can enter some confusion in, so you do the exact right thing and they get worse. Well, the good news is Dr. Ulen discovered some things to help that, to remedy that situation. So if a person has a nervous system that's not responding to care, Dr. Ulen discovered they can actually be blocked to healing, and that's what he calls it. It's blocked regulation. So remember, regulation only means that the body is regulating its functions in response to a stimuli. Well, if they have blocked regulation, then they cannot, or actually the body can't respond the way it should respond and needs to respond to even accept the treatment protocol that you're doing. And the other thing that can happen to that body is it can become switched or confused, which means if you do something, the body is in such a state of confusion that if you want the body to go left, it decides it should go right instead. So things you do to help the body actually make it worse. So that's where Dr. Ulen discovered the 5 barriers to healing. And the 5 barriers to healing are nothing more than 5 environmental factors that can adversely affect a person or that can overwhelm a person's nervous system. So let's go over those 5 barriers to healing. The first barrier is called common foods. Well, guess what? We all eat every day. Chances are many of us have been eating things regularly, way too often, way too long, and because of certain factors that happen in the gut, it can start causing the person to get stressed by the food they're eating, which causes the nervous system to basically shut down, or I'm sorry, it doesn't shut down, but it becomes blocked from accepting anything. So therefore, if you can identify which food or food groups the person is consuming that's adversely affecting their ability to respond to the care you're giving, we can do things to actually unblock the nervous system and get it open to accepting treatment. Now, another of the 5 barriers to healing is called the immune challenges. Well, all day long, we are being affected by immune situations in the environment. The bacteria, the viruses, the parasites, the fungi and molds. And then the 5th area that Dr. Ulen found is there can be some what he has termed virulence factors. That's nothing more than the body handled a previous immune challenge, but it left behind cellular debris. because of that cellular debris, it basically overwhelmed the body because it needs to get rid of all the accumulated cellular debris. In other words, the exit channels didn't help exit all the toxins as well as they could have or should have. Now, another barrier to healing are metal toxicities. Well, once again, thanks to environmental factors, we're exposed to metal toxicities all day long. You know, those come in the form of, well, mercury, dental amalgams, maybe some immunization shots that had those in. We're always being adversely affected by aluminum products, such as deodorants. We can also be adversely affected by things such as arsenic. I don't know if you're aware of it or not, but the poultry industry actually uses arsenic in order to protect the chicken from getting sick because they can't use any antibiotics. Unfortunately, the arsenic can occasionally accumulate in the flesh of the chicken, and then we eat chicken and we can be adversely affected by the arsenic that's in the chicken. So those are three of the factors now that can cause the autonomic nervous system to get overwhelmed. Now the next area are toxic chemicals, such as the fluorides and the chlorines, the bromines. And there are many other factors, such as electromagnetic frequencies. Those can be handled with good nutritional supplements to help the body ward them off. All you have to do is find out if they are affecting that person and then recommend certain specific nutritional supplements in order to help them with that particular chemical toxicity. Then the last of the environmental factors is a bit confusing. It happens to be scarring on the body. As you know, if the skin gets interrupted, such as with a cut, a scrape, from a surgical procedure, an injury, piercings, tattoos, various things can break the surface of the skin. And when the skin heals, it heals with a scar. The issue is not the scar itself, but the nerve inside the scar. If you'll remember a little bit of your anatomy and physiology, you'll understand that the sympathetic portion of the autonomic nervous system is primarily what's in the skin. So when you break the surface of the skin, when the body heals, it actually heals with increased sympathetic nerve fibers. This was all research done by a set of Germans actually back in the 50s, and Dr. Uhlin discovered it from a Dr. Reinhard Klinghardt early on in his career, and that's what actually helped handle his particular health issue at the time. So we use a product called wheat germ oil because it has been discovered that wheat germ oil will desensitize the nerve interference located within the scar, and that's the body telling you that, hey, there's a scar someplace on the body that needs to be addressed. Now, this sounds a little bit complicated. It's not. I would like to give you a couple of demonstrations to show you how it works, because it's not very difficult, but it is a little bit confusing if you've never seen it before. So let's take a look. All right, so I hope all of you can hear me since I moved a little bit away from this microphone. The first thing we're going to address is a thing called blocked regulation. So, blocked can be translated as stuck. The autonomic nervous system is stuck, and it basically won't accept anything you're trying to do for it. So let's describe what that could be. Well, it could be the chiropractic adjustment we give. The body's blocked from accepting the benefits of it. It could be it's blocked from accepting acupuncture treatment. It could be they're blocked from accepting the benefits of a massage. Have you ever had a person you heard that got a massage and they go, wow, it felt like I needed another massage by the time I got out to the car? Well, that's a typical conversation that you hear from people who have blocked regulation. Another thing to understand is no nutritional supplements will work because the body's blocked from accepting the value of the supplements. So let's actually see what that looks like and how we would handle that. So in nutrition response testing, the first thing we have to have is a muscle, because this is a muscle response testing procedure. Now, it's important to understand it's not a muscle strength procedure, it's a muscle response. As Dr. Uhlin always says, we're looking to see if a strong muscle starting from a locked position. So a locked muscle is nothing more than a muscle, but when you apply some pressure to it, it can stay pretty rigid. So I'm going to apply pressure here, and she's going to have a nice lock, which indicates the arm did not go down. Now I'm going to check the area for regulation, which means I'm going to place my hand in a certain position. I'm going to place the center of my palm over her belly button. And if it was normal, when I push on the arm, her arm would go down. That's the signal that the autonomic nervous system is paying attention. It is not blocked or stuck. However, most patients who you may want to test in the beginning because they're not responding come in and say things like, "Doc, you know, you've adjusted me 3, 4, 5 times and I see absolutely no difference. I've done all those exercises you told me. I went to the gym and I've been working out for several weeks. I haven't even lost a pound of weight." Well, that's an indication their autonomic nervous system is in a condition called blocked. The fancy term is blocked regulation. And it looks like this. When I push on the arm, this arm should go weak because the system is not responding to this benign stress. So the way we handle that is to take our 5 stressors test kit, and we always start with food, because food is the most common thing that people consume on a regular basis that can overwhelm them. Not because it's bad food, it's just people tend to overeat the things they like to eat, which then leads to overwhelming the body, shutting it down. Those of you who are chiropractors may have read Dr. D.D. Palmer's book, The Chiropractor's Adjuster. And in his book, he actually talks about overeating foods that then becomes a noxious substance which adversely affects the nervous system. Well, Dr. Ulan discovered that is true, and we can use these test kits to find out. So the way I use this, I take this test kit. This side has vials in it labeled with various foods, and I will place the foods vials on there. And if I push against her arm again and the arm does not go down, it doesn't go down, that's to indicate food is not involved with this condition. Then I turn it over to the other side of the test kit, which has the immune challenges in, and I lay the immune challenge side of the test kit against the body. I place it, my hand over the belly button, I push on the arm, and then once again it stays up. That's an indication that the immune challenges are not part of this blocked nervous system situation. So then I will go to the next side of the test kit called metals. I will place the metal vials against the body, place my hand over the belly button, and the arm goes down. That's an indication that one or more of the vials that have different metals labeled on them is affecting this person's autonomic nervous system to the point where it overwhelmed it, so it became blocked or stuck. So the most common one is mercury. So in this case, I'm going to take the mercury vial out of the test kit, set the test kit off to the side, take the mercury vial and lay it on the body, place my hand over it, and the arm goes down. That's an indication she has been overwhelmed by the heavy metal mercury, possibly due to some amalgam fillings, possibly due to old inoculation shots. And unfortunately, mercury is involved with a lot of chemicals. You may know one called Lysol. Well, mercury's in Lysol. So people who disinfect using Lysol can get some mercury exposure. So I'm going to use a product from a company called Standard Process, and it's just called parotid PMG. The parotid PMG strengthens the body's parotid glands. The parotid gland's job is to protect the body from metal and chemical toxicities, but it tends to get overwhelmed in today's toxic environment. And I would put my hand over belly button, I would push on the arm, and it goes down, which indicates I can use that. Well, in this case, that parotid supplement will only help the body start pulling the heavy metals out of wherever the body has it, the body doesn't think it needs it there. Unfortunately, it'll put all those metals into the large bowel, because the purpose of the large bowel is elimination or reabsorption. So we need to actually put a binder with it. We want the metals to get bound up on that substance, so at the next bowel movement it gets out of the body and doesn't get a chance to get reabsorbed in the digestive tract in that large intestine to be stored someplace else. So then once again, I take my hand and place it over there, and the arm goes down. Well, that's an indication, yes, I can use these 2 supplements here to help this body open its regulation, which then will get the autonomic nervous system to respond appropriately to whatever other kind of modality you are trying to help the person with, be it acupuncture, chiropractic, massage, exercise therapy, dieting in and of itself. So there are many facets to a person's health that need to be addressed, and we want them all progressing and moving forward by not having any blocked regulation. So just to continue the procedure so you can see the protocol, I have to take the supplements away from the body because there are 5 stressors to be checked, and so far I've only tested 3 of them. So now, once I remove the products that open the regulation due to the mercury, I place my hand here and it goes strong again. Remember, it should be weak. So now I'll see if there are any chemicals involved with this condition, and it stays locked. That's an indication there are no chemicals involved. Then I will set the test kit aside. And the last thing I'm going to do is I'm going to take the wheat germ oil, place it on the body, and that's asking the body, hey body, are you being affected adversely by some scars someplace on the body? If the arm stays locked when I put my hand over the belly button, that's an indication they are not blocked due to scars. So therefore, I can place, after I've completed all 5 of the stressors, I can place the products on the body for that mercury I found, verify that regulation is open. Therefore, this patient's nervous system is very willing to start accepting any other treatment protocol I would like to render this person. Now, the next thing we want to look at is a condition called switched or switching. So switching is just an indication that there's confusion in the autonomic nervous system, which means things you would normally do to help the person get better, the body will actually use against it. Have you ever had somebody say, boy, I just can't stand to get a massage because it just hurts when I'm laying on the table? Well, and thumb touching go through the various vials. For demonstration purposes only, we're going to pretend that she's being affected by white refined sugar. So I take the white refined sugar vial out and I lay it on the body. I push on her arm. It's strong. That's an indication that her body is being adversely affected by the white sugar. So then with the white sugar vial out of the box, I place the rest of the foods on the body and it goes weak, indicating there are no other foods involved with this switching component. Now in this case, because it's a sugar, I'm going to use a standard process product called multizyme. Multiple pancreatic enzymes is what it stands for. And as you know, the pancreas handles sugar. So I place the multizyme on her body, I press on her arm, and her arm stays locked, which means I can use this product to help her body handle whatever that sugar had done to confuse her. Now, once again, I have not completed all 5 stressors, so I have to take the multizyme away from the body so I can complete my 5 stressors test kit. So now I take the immune site, of the test kit. I lay it on the body, I push on the arm, it goes down. That's an indication there are no immune challenges associated with this switching component. Then I go to heavy metals or the metals. I lay that on the body. I press on her arm, it goes down. So that's an indication there are no metals associated with the switching. Then I place the chemical side of the test kit on the body. I push on the arm, it goes down. That's an indication that she has not switched due to any metals. And then the last thing I do is I take the wheat germ oil, I place it on the body, I press on the arm, and it goes down. So that's the body giving me a signal that the only thing that's confusing her nervous system, causing this switching, is the food for which we can use multizyme. So I take the multizyme, I put it back on the body, I verify that it is now strong. And then I have her disconnect that. So now I could do some other form of treatment. Let's say I needed to give her a chiropractic adjustment. I could now do that, and her body would no longer use that chiropractic adjustment in the reverse of what it had been doing, such as it's well known that in chiropractic, when you adjust somebody's lower back, they get pain starting to radiate down the leg. Well, sometimes it goes too quickly, too fast, patients don't like it, and sometimes that happens only because they're switched. So now I could have her consume this multizyme right in the office, and then I could go adjust her, and her body would actually take that chiropractic adjustment and use it in the direction that it actually needed to go, not reversing what it was supposed to do. Or I could complete a nutrition response testing exam, and at this point I would do a thing called a body scan. And all the body scan means is I would be touching various parts of the body to see what happens when I touch it. So let's pretend if I touch her thyroid now would go down as I touch it and continue doing all the various body parts. That would be an indication that her thyroid is a bit under stress. And then I would have to ask the body, are you interested? That is the beauty of the nutrition response testing system. If 2, 3, 4 areas of the body show up to be under stress, we can actually ask the body, hey body, what of those areas are you interested in? What I've discovered after about 400 and some odd thousand patient contacts over the last 45 years, that what the body wants to handle is rarely what the practitioner or the patient wants to handle. But I've discovered if I handle what the body wants to handle, this person tends to recover a lot faster than if we don't ask the body what it wants to handle. So again, once again, I have determined through the testing procedure of the what we call our flow chart, there's a basic 13-step protocol for nutrition response testing, that the thyroid is the main area under stress. So once again, I would use the 5 stressors, starting with food, to determine if there is an environmental stress factor that has overwhelmed the thyroid. I touch the thyroid with food, arm goes down. That would tell me there are no additional foods that she may have consumed affecting that, besides the first food we found called white refined sugars affecting her switching component. And then I turn it over to immune challenges. The arm goes down. That would be an indication that there are no immune challenges affecting the thyroid. Once again, I will go to heavy metals. Arm locks. Again, that would be an indication some heavy metal is affecting her. And for demonstration purposes, I'll go back to the mercury and we'll pretend that it is mercury in this case. So I lay the mercury vial on the body. I touch the thyroid and the arm stays nice and locked, rigid. That's an indication that mercury has adversely affected that thyroid. I take the test kit now minus the mercury. And once again, I ask the body, thyroid, are there any? And it goes down. It says, no, you found the only one affecting me. So again, as in our other example, I would use parotid. Parotid stays nice and locked. I want to make sure it continues to go out of the body, so I add the what's called a binder to it. It stays locked. Now, in this case, I have not completed all the stressors, so I leave on the multizyme because multizyme handles the switching component, but I remove the stressors for the thyroid because I still have to do chemicals and scars. So I put the chemical side of the test kit on the body, and it goes down indicating there are no chemicals involved with this. And again, I would use wheat germ oil to determine, and no, there are no scars involved with this. Now the next thing I do is I put back those bottles, those supplements that handled the mercury I'd found in the thyroid, and so it is nice and strong. But all I know at this stage is that I can take some stress off of the thyroid, but I want to ask the body, would you also like some additional help doing your job? So there, for that scenario, I'm going to take a product called Thytrophin. I actually add Thytrophin to the mix. I still touch the thyroid, and it says, yes, I would also like some thyroid. If it didn't want the Thytrophin, the arm would go weak. But in this case, the body says, yes, I would actually like to have this thyroid helper on me called Thytrophin PMG. It locks up. Now, in order to complete my 13-step protocol, all I have to do is make sure this person doesn't need any additional digestive aids by touching some digestive reflex points. I want to make sure I'm not overwhelming the patient's body. I touch a stress point behind her ear. My final regulation to make sure it's open, to make sure I'm not going faster than what the body needs. And then I would do a protocol called dosing. So, thank you.
Yep.
So there was a very brief demonstration of how nutrition response testing protocol works. This whole system is what actually handled my personal health condition that I'd been dealing with for almost 50 years, but by the time I met Dr. Ulen, it's the protocol that actually was used on Dr. Ulen that saved his life back in the 90s. And if you would like to learn more about this, now we have a way for you to do that in the comfort of your own home. So we have a nutrition response testing online course. There's actually no prerequisites to do it. And so if you've never been introduced to nutrition response testing, this is a good way to start to learn some basic protocols about it. And if you've been exposed to nutrition response testing, it might be a good refresher for you. It's a 25-part video series, which lasts about 2 hours. It's very user-friendly. There are some downloadable guides on there and charts and reference materials. And there's also extra case scenarios so you can see other people actually getting tested for real. You actually have access to it 24/7. So you can come back to it over and over and over again. So if you'll flip that chart so they can see the web address. So just go to that website called www.bit.ly/onlineuns. Type in the code of Brad25. Now the course is normally $125, but until this Sunday, April the 7th, you can get $25 off. So please go there very quickly because I would love to see you start using this on your patients, because my purpose has always been to help others improve the quality of their health and the quality of their health care to their patients. Thank you for attending.